morning, everyone. Our today's topic of discussion is frozen section, its overview and application. Frozen sections are also known as quick sections or intraoperative consultation. In histology, sectioning refers to cutting the paraffin embedded or frozen tissue sample. There are two main categories of sectioning. One is paraffin sectioning and second is frozen sectioning. Frozen section is the rapid tissue section, which is taken after cooling the tissue with the help of cryostat in order to give immediate report of the tissue sample, which is needed to diagnose or to define the extent of lesion intraoperatively. So cryostat is an instrument which is used for freezing the tissue, which hardens the tissue, and then we can cut the frozen tissue. We'll just take a look at the milestones. Uh, it was in 1891 when William H. Welch from John Hopkins Hospital reported a frozen section of suspected breast malignancy case on request of surgeon William Halstead, and he at that time he used carbon dioxide as the freezing agent. Then later in 1895, it was Cullen who described a rapid method of making permanent specimens from frozen sections by the use of formalin, and it was printed in the John Hopkins Bulletin. Then in 1905, it was Louis Wilson at Mayo Clinic who developed frozen section staining method using the methylene blue stain. In 1920s, this technique became popular and was used for intraoperative consultation in everyday practice, and it was promoted by the American Society of Clinical Pathology in 1922. Then in 1959, preparation of frozen section was made even easier by the development of modern cryostat, which is a cabinet which is cooled to around minus 20 to minus 30 degrees Celsius, and it also encloses a microtome blade. The use of frozen technique peaked up during the 1970s, but later again it decreased due to the better pre-op imaging and other diagnostic methods. Now, as we know, what are the steps which are included in the tissue processing of formalin fixed tissues? We'll just take a look at it. That is, the first step is fixation using formalin, then dehydration, then clearing, then embedding, then sectioning, then staining, and then finally cover slipping the stained slide. So all these steps take around take hours to days to complete the complete process to get the stained slides. In frozen section, what happens is we skip all those steps of tissue processing, and within 5 to 20 minutes we prepare the slide. So here what we do is we freeze the tissue at around minus 20 degrees Celsius to obtain a hard tissue matrix. Then we do cryo sectioning of the frozen tissue and we place it on the glass slide. It is followed by H&E staining, and then it is visualized under the microscope. So this is the cryostat, which is a cooled chamber or the cabinet that houses an instrument to section the frozen samples, a rotary microtome and knife or blade holder, and a means to freeze the samples. So this is the cryostat instrument. There are different types of cryostats. One is single compressor, uh, which is used for cooling the chamber only. Then there is double compressor, which cools both the chamber as well as the object. Then again there is manual sectioning cryostat and motorized sectioning cryostat. The normal working chamber temperature is 0 to minus 30 degrees Celsius. The limiting factors are the compressor and the refrigerant. The section thickness which we get using the cryostat is 1 to 100 micrometers or even higher. Now for the freezing of fresh unfixed tissue, we can use various agents. One is liquefied nitrogen, which can give you a temperature of around minus 190 degrees Celsius. Second is isopentane cooled by liquid nitrogen, which helps in attaining around minus 150 degrees Celsius of temperature. Then there's dry ice, which gives you minus 70 degrees Celsius of temperature. Again, carbon dioxide gas gives you minus 70 degrees Celsius. There different aerosol sprays are available, which helps in attaining a temperature of minus 50 degrees Celsius. Then there's internal freezing shelf or bar. Now here we can see this picture, and we can see the the apparatus of cryostat. Okay, so there is a rotary microtome with external handle. Now in this picture you cannot, the handle is not visible. Okay, but this is the microtome. Like here you can see the blade holder. Then here it is your block holder. This is your freezing shelf. This is a Peltier device. Okay, Peltier freezing stage is a nothing but a thermoelectric device which helps in increasing the diffusion of heat from the sample, thus helping in rapid freezing of the sample. Okay, then this is, like I said, this is the blade holder, and there are different types of blades which we can use. One are the reusable blades, which are again of two types, that is C profile, which are made up of steel, and D profile, which are made up of tungsten carbide. Then second type is disposable blades, which again are of two types, that is low profile and high profile. So depending upon the width of the blade, they are like low profile and high profile. Also, there is this anti-roll guide. Anti-roll guide is nothing but like there's a aluminum stage, okay, and there's a glass cover over it. So there's space between this glass cover and the aluminum stage. The space can be 50 micrometer or 100 micrometer or 150 micrometer. Okay, so while taking the section should not roll up on itself, as it will cause folding. So to prevent that, we use this. They have installed this anti-roll guide in it. Okay, then there are chucks with stem. We'll see those chucks in later slides. Now, while using the formalin fixed tissue, we use wax for embedding the tissue, right? So while making frozen sections, we use OCT, which is latex optimum cutting temperature. It is a viscous aqueous solution of polyvinyl alcohol and polyethylene glycol. Okay. There are other mounting media available like water, bovine albumin 20 to 30%, and one apatase calm syrup. So here you can see in this picture, this is the hand wheel. Okay, this is the freezing shelf. Here we have placed the chunks with the tissue which is placed in the OCT. Okay, and this is the blade holder. This is the block holder, and this is brush. Brush is usually used for wiping off or clearing the this stage. See, these are chucks. This is the stem of the chuck. So we place the tissue here, and then we pour this OCT over the specimen. Okay, once we place the specimen, we keep the chunk here on the freezing shelf. Once the tissue freezes, we put it on this block holder, and then we take sections. See, we have taken section here, and we just have to touch the glass slide over the section, and then your section is ready. So different depending upon what tissue we are using or what sample we have received, the optimum temperature for different tissues is different, which depends on the water content and the lipid content of the tissue. So brain, liver, spleen, the optimum temperature is -70 to -10 degrees Celsius. Rectum, uterus, adrenal, muscle, skin, the optimum temperature for these specimens is -12 to -15 degrees Celsius. Then for heart, lungs, intestine, pancreas, ovary, cervix, prostate, it is around -16 to -20 degrees Celsius. Bone marrow and breast requires a temperature of -20 to -25 degrees Celsius. Now, this is just a table to show, to explain the accuracy of frozen sections as compared to the paraffin sections. Okay, so almost around the overall accuracy rate is almost 95%. Now we'll just see all the steps right from receiving of the frozen section to gross examination and to sectioning. So first, while receiving the specimen for frozen section, what we have to see is we have to see if they have properly labeled what all is mentioned on the label. We have to check that. Then once we are taking the specimen for grossing, we have to see examine and palpate all external surfaces of the specimen carefully. Then we should understand the resection margins. In case of discrepancy, we should immediately contact the operating surgeon, and we should ask him for the resection, to label the resection margins properly. Then next is inking the resection margins. Inking is very important. Like it will help in preventing misinterpretation. It will prevent false positive marking, labeling of the resection margins or like that. Then next is examining the cut specimen. We should properly examine the cut surface, and we should see from where we should take our section. Okay. Then next is taking the section for frozen section. Then next is cytology preparation. What we can do is while we are waiting for the frozen section for the slide to get ready, we can just make some cytology preparations, like squash cytology. We can do squash cytology or scrape cytology or imprint cytology, as it is like it will help in reaching the diagnosis. Next is section preparation and staining and reporting. Now, while taking the section, there are two ways of taking the section. One is perpendicular section of margin, and other is shave margin. So when the tumor is a bit distant from the resection margin, we can take the perpendicular section. Okay, so that it helps in determining the distance of the tumor from the margin. If the tumor is near the resection margin, we can just take a shave margin, and it will help in examining a large surface area for defining for seeing the tumor involvement. Now, these are the different cytologic preparations. One is first here, you can see touch preparation or imprint preparation. Next here, we can see scrape preparation. Then this is squash cytology. Squash cytology we usually use for CNS tumors. Now, these are the different embedding techniques for fresh frozen section. We can use face up embedding, can use face down embedding, or the cutoff technique. Now, what is face up? The portion which we want to see under our microscope, that is on the slide. If we are placing that surface upwards, then that is face up embedding, which we usually do in our institute. That is face up embedding. In usually in fix While embedding the paraffin embedded formalin fixed paraffin embedded tissue, we use the face down embedding technique. The cutoff technique is, see, this is the cutoff technique. When the tissue is very soft, or there are chances of distorting the anatomy of the specimen, we can use this cutoff technique. What we do is we just keep the portion which we want to see under the slide under the microscope. We keep it like this on the glass slide. Then we pour the OCT, we let it freeze, and once it freezes, we just cut off the excess of tissue. Okay, see here, you can see we are cutting the tissue which is which is outside the OCT, and this portion of the tissue will use for sectioning, and we'll see it under the microscope. Yeah. Now, orientation of the anatomy of tissue relative to the blade is important. Like if we want to see the mucosa as well as the underlying tissue, we need to orient this tissue accordingly. Like the mucosa or the epidermis, it should face sideways. Now, coming to the variables affecting the cutting properties of tissues and the resulting artifacts. Temperature of the block. So we should adjust the temperature of the block depending upon what tissue we are using. Okay, like I mentioned earlier, the various optimum temperatures of various organs or various tissues. Now, cutting behavior of specific tissues. If the softer tissues which are having higher lipid content, we need to freeze it to even lower temperatures. to make it harder, right? And the tough tissues, we do not need to freeze it, like we can freeze it up to minus 10 degrees Celsius or minus 20 degrees Celsius, and it will get hardened. Curling away. To prevent curling away, we already have that anti-roll guide. Okay, so the ideal bit size is 20 by 20 by 2 mm. Now coming to fixation, staining, cover slipping of the frozen section slides. Uh, yeah, so fixation, usually what happens is the section which we are taking, okay, using the cryostat, it is at a lower temperature, and the glass slide which we are using, it is at room temperature. Okay, so and also the section which we are using, it is fresh section, so it is already, because of the proteins and everything, it is charged, so it easily gets adhered to the glass slide. Okay, also because of the temperature difference, it gets fixed to the glass slide. Then we'll do the staining. Will staining, yeah, or we can also use toluidine blue staining. We can also do special staining on frozen sections. So rapid H&E method, I'll just tell you the steps of rapid H&E method. We fix the section in formal acetic acid alcohol for 20 to 30 seconds. Then we rinse it in water for 10 to 15 seconds. Then we stain it with hematoxylin for 1.5 to 2 minutes. Then again we rinse it in tap water. Then we stain it in eosin for 10 to 15 seconds. Again, we rinse it in water for 10 to 30 seconds. Then we dehydrate it through various grades of alcohol. Then we clear it in xylene, and then finally we mount it in DPX or Canada bulbs. Now coming to the microscopy and reporting. So basically, while reporting a frozen section, we have to keep many things. We have to take many things into consideration. Like first is time. uh, in within like 20 to 25 minutes we have to tell the surgeon the report, because the patient is already under anesthesia, right? So we have to give the rapid diagnosis. So while so right from grossing, even the gross examination we should take into consideration, even the cytologic preparations we should take into consideration while reporting the frozen section. Then there are various freezing artifacts which we come across while reporting the frozen section, like ice crystals or compression artifacts or nuclear ice crystals. Also, there's this term that the many phases of necrosis, which is a potential pitfall. Like while taking sections for frozen section, we should try to avoid taking sections from the necrotic region. Okay, why, we'll see that later. Okay, so as we are using fresh and fixed specimen for frozen sectioning, or we are using cryostat for unfixed sections, we need to see that we are properly disinfecting the cryostat after use. Okay, we should check the waste tray regularly, and we should empty it. Then we can use gauze piece, which is soaked in 70% of alcohol. Even other disinfectants are available, like a disinfectant spray system or formaldehyde vapor, or there's this combination of disinfectant spray and UV light and ozone. Okay. Now talking about cryostat maintenance, we should check the lock or remove section debris, specimen, blade, cryo compound. All this should be done like on daily basis. Then weekly, we should empty the fluid container. We should clean and lubricate all contact surfaces. On monthly basis, we should we should do spindle lubrication. Then we should retract the spindle to home position, and we should check side compressor vents as well. And annually, we should do the servicing of the instrument. Now, this is a list of various manufacturers of cryostat uh, instrument. Okay, so most commonly we can see this Leica. Uh, yeah, Leica cryostats. The one which is there in our institute is CM1860UV. Okay, so these are different models of Leica cryostat. So this UV indicates that it is giving this machine like uh, protects the user from UV radiation. The price of Cryostat ranges from around 7 lakhs to 30 lakhs or even higher. And cost per test in private labs in Mumbai on an average is around 9,000. So now what are the applications of frozen sections? Frozen sections are used to establish a tissue diagnosis that will help the surgeon to avoid subsequent surgical procedure or to make primary diagnosis when pre-op diagnosis is not available. It also helps in identifying metastatic disease. It helps to obtain sufficient diagnostic tissue for IHC. It helps in assessing surgical margins as well, whether they are involved or if they are free of tumor. Frozen sections can also be used for quality control of surgical pathology laboratory. Now we'll take a quick look at the advantages and disadvantages of cryostat. So advantages are like it gives rapid on-table diagnosis. Also, certain staining procedures which are like uh, also this frozen section can be used for certain staining procedures like fat staining by oil red O method or silver impregnation method. Even lipids and carbohydrates can be easily demonstrated using the frozen section. Frozen sections are ideal for demonstrating enzymes as we are using unfixed tissues. And also they are used for immunofluorescence in immunocytochemical method. Now, what are the disadvantages? Disadvantages are staging of unfixed tissue is not as satisfactory as the paraffin-embedded permanent sections. Also, the structural details are somewhat distorted during the section cutting. There are chances of many freezing artifacts. Then there can be sampling error or technical error or even interpretative errors. Okay, so interpretative errors. Because of artifacts or heterogeneity of the tumor, like the or having like if the tumor is having variable tumor differentiation or mixed tumors, there are it depends on the section, like from which portion you are taking the section. So in such cases, interpretative errors can occur. Now, like I said, like I mentioned earlier, that there are many phases of necrosis. Now here, these are all tissue like frozen sections. Here, this is this this is necrotic area. Okay, so this is the same portion which is highlighted here. So here you can see the necrosis clearly. Okay, so but if in these images like C and D, here what has happened is the cells are in early necrotic stage. Okay, so we might misinterpret it as lymphoma or something else. So we should take into consideration that necrotic regions that studying sections from necrotic regions might cause interpretative errors. So that's why we should try to avoid taking sections from necrotic regions. Now this is freezing artifact bubbles. Now this is a section from this is renal tissue. Okay, so A is frozen section and B is paraffin section. So in A you can see many bubbles here, right? The stroma is edematous, but there are many bubbles seen which yeah. And here in paraffin embedded section, here also you can like here at least you can appreciate the edematous stroma properly. So this is one freezing artifact. Second freezing artifact is compression artifact. Now here what is happening is because of the bubbles, you can see these tubules, this scalloping and compression of the tubules here. This is a frozen section. This is the paraffin embedded section. Here you can appreciate the tubules properly and the edematous stroma properly. Okay. Now again freezing artifacts, that is chromatin changes. Now see A, B and C. A is uh, frozen section. B is uh, B section is from fixed tissue, which was previously used for frozen section, and C is from paraffin embedded section. Okay, so here in B, you can see that there's a blunting of nuclear membrane and also the chromatin. There's, you can see hyperchromasia here. So again, this will cause interpretative errors. Now here, these are coming to nuclear holes, freezing artifact, that is nuclear holes. In A and B both are frozen section only, but A is a thinner section and B is a thicker section. In A, you can see this nuclear holes here. Okay, the same nuclear holes are not seen here when after taking a thicker section. Okay, so if in case you are getting such nuclear holes in some case, you can ask the technician to give you a thicker section so that you can see the details, nuclear details properly. Now see here, these are the drying artifacts. Okay, so in immediate fixation, A and C are sections taken after immediate fixation, and B and D are sections taken after delayed fixation. So you can clearly see that the detailing is lost to certain extent uh, in the sections which are made after delayed fixation. So we should take care that we should like immediately fix the section to avoid drying artifacts. Now this is the difference between formalin fixed paraffin embedded tissue sections and frozen sections. Tissue morphology is well preserved in formalin fixed tissues. For long-term use also, formalin fixed for paraffin embedded tissues are better. Then section thickness, we can make thinner sections using formalin fixed paraffin embedded tissue. While in frozen section, like just I explained about the nuclear holes, we need usually we need thicker sections. Now and then enzyme activity and labile antigen preservation can be done using frozen sections, and it cannot be done using formalin fixed sections. Also, antigen immunoreactivity can be demonstrated using frozen sections, as there's no epitope masking in frozen section. In formalin fixed section, what happens is the formalin masks the epitopes, and hence uh, antigen retrieval is often necessary if you want to use it for antigen immunoreactivity. In formalin fixed paraffin embedded tissues, we need to do fixation prior to embedding, and in frozen sections, it can be done after section. Frozen sections are frequently used for ovarian masses, for CNS tumors, for pelvic masses, in cases of melanoma for resection margin or BCC, then also in thyroid tumors. Now coming to recent advances or modifications. There's this modification that nowadays what they do is they fix the tissue using gum sucrose as fixative, and then they use this fixed tissue in the cryostat. Till now, what we were seeing is we were using this unfixed fresh tissue uh, in the cryostat for making frozen sections. So this is a modification that they use this fixed tissue in the cryostat. Then nowadays, because of the use of FNAC, usually breast malignancies and thyroid tumors, they don't require frozen sections for these cases. Also, intraoperative cytology is a better option. Like usually, it is helpful in CNS tumors. Intraoperative cytology. Then low-cost non-commercial method of real-time telepathology for light microscopy that can be done that can be used to assist intra-departmental consultation for frozen section diagnosis. Like in our institute, what we do is the neuros we do this use this real-time telepathology while diagnosing the CNS tumors. Okay, so here this is an example. This was a case of Hirschsprung disease, and the surgeon wanted to know the resection margin of colon. So here they had sent this resection margin, okay, this specimen of colon. So here in this section, you can see here the ganglion cells, okay. So uh, you can see here the ganglion cells. That is which means that the surgeon has resected the colon properly. and adequately. This is second case. Okay, so we received left-sided ovarian cyst, which on cut section was multiloculated with serous fluid. On frozen section, we could see a cyst which was lined by tubal type of epithelium, which was focally thrown into simple papilla without, and there was no crowding and ATP of the nuclei. So we reported it as serous cystadenoma. So here the surgeon wanted to know if it was malignant or benign. So it was not malignant, and we reported it as serous cystadenoma. Okay, so these are our references.